Hello everyone, I come from Pharmacovigilance Department of Beilu Pharmaceutical Company Limited. It is my great honor to introduce the following content about reasonable use of Iohexol injection and management of adverse reactions to you today. I will introduce from the following three contents. The first is before using Iohexol injection. The second is reasonable use of Iohexol injection and storage. The third is after using Iohexol injection. Firstly, let's introduce the first part, before using Iohexol injection. Before using the drug, we need to understand the patient's basic information, such as medical history, because some patients are prohibited from using Iohexol injection. If the patient has severe symptoms of serotoxicosis, prohibition of use it. If the patient has a history of severe allergies to Iohexol injection, prohibition of use it. However, there are still some patients who can use Iohexol injection, but there is a higher risk of adverse reactions. So a benefit-risk assessment is needed. The first is patients who have previously experienced moderate to severe anaphylactoid reactions to iodine contrast agents, or patients with a history of allergies requiring treatment. They are all at higher risk. The second is about kidney function. Iodine contrast agents can cause acute kidney injury, and patients should be evaluated for related risks before examination. In addition, some combination medication that may increase the risk of adverse reactions, such as neuroleptics and antidepressants, interleukin-2, beta blockers, metformin. There are also patients with hyperthyroidism who use Iohexol injection may cause hyperthyroidism to become serious or even thyroid crisis. These people must carefully assess benefit and risk before using it. Examination rooms need conventional emergency equipment, medicine, and trained medical persons, and regular inspections should be conducted to ensure that the therapeutic drugs are within their shelf life and that all equipment is functioning properly. Medical persons should be familiar with how to treat and rescue patients, activate emergency systems if necessary, and quickly seek help from other relevant medical departments. The contact phone number of the cardiopulmonary resuscitation team should be clearly announced and kept open at all times. Emergency equipments can include oxygen supply equipment and oxygen masks. Both adult and child specifications are required, include nasal or oral airways or respiratory protective films, ambu-tape face masks, and masks with protective films. Both adult and child specifications are required. Include intravenous infusion catheters, syringes, and needles. These need to have different sizes. Also need to include stethoscope, blood pressure monitor, pulse oximeter, defibrillator. About therapeutic drugs, examination rooms need to have adrenaline, atropine, beta-2 receptor agonist, aerosol, diphenhydramine, nitroglycerin, normal saline, lactated ringer's solution, 50% glucose injection. If we have the above equipment, medicines, and medical persons, the examination room is ready. Due to the unpredictability of anaphylactoid reactions, or iodine contrast agents, and the specificity of diagnostic medication. It is recommended to seek informed consent for patients using Iohexol injection with patients and their families or guardians before using it. Informed consent Informed consent can be included in the surgical notification, and informed consents inform the indications, control indications, possible adverse reactions, and precautions of the use of contrast agents, and patiently answer the questions of patients and their families. Eliminate their doubts, relieve their anxiety, which is conducive to reducing the occurrence of adverse reactions. It needs to be hydrated and preheated before using Iohexol injection. Hydration is required within 6 to 12 hours before to 24 hours after the use of an ideal contrast agent. If arterial use, the patient should be given intravenous infusion of 0.9% normal saline or 5% glucose plus 154 millimoles per liter solution bicarbonate solution. 6 to 12 hours before the contrast agent injection, be equal or greater than 100 milliliters per hour. Continue for 24 hours after injection. If intravenous use, the patient should orally drink water or drink normal saline 4 to 6 hours before Iohexol injection and continue until 24 hours after injection with a dosage of 100 milliliters per hour. In addition, before using Iohexol injection, it is recommended to heat it to 37 degrees centigrade and place it in an incubator. There is no need to carry out the allergy test routinely, unless specifically stated for some drugs. Because patients with negative allergy test results may also develop anaphylactoid reactions or even severe anaphylactoid reactions, and conversely, patients with positive results may not necessarily develop anaphylactoid reactions. Allergy tests can even cause serious adverse reactions. So, ideal contrast allergy testing is not recommended. High-risk groups, like patients with a history of previous allergy to iodine contrast agents, these people can use prophylactic drugs. But studies have shown that the main benefits of prophylactic drug use are the mild adverse reactions that don't require medical intervention, or adverse reactions require only mild intervention. It is very important to note that despite the use of prophylactic drugs, anaphylactic reactions can still occur. Healthcare professionals must be prepared to treat these adverse reactions. The administration of recommended prophylactic regimen is listed here. If the patient is selective preoperative administration regimen, there are 3 prophylactic regimens to choose from. The first protocol is prednisone 50 mg orally 13 hours, 7 hours, and 1 hour before Iohexol injection, and a different regimen 50 mg intravenously, intramuscularly, or orally 1 hour before Iohexol injection. The second protocol is prednisolone 32 mg orally 12 hours and 2 hours prior to Iohexol injection, may also be combined with antihistamine such as diphenhydramine, but if the patient can't be given orally, 200 mg of hydrocortisone may be given intravenously to replace oral prednisone. If the patient is emergency preoperative administration regimen, there are also two prophylactic regimens to choose from. Firstly, for patients undergoing emergency PCI, intravenous misprednisolone 80 to 125 mg or hydrocortisone sodium succinate 100 mg is recommended, along with oral or intravenous diphenhydramine and, if possible, intravenous cimetidine. The second protocol is one intravenous dose of misprednisolone sodium succinate 40 mg or hydrocortisone sodium succinate 200 mg immediately, and additionally every 4 hours until the use of the required contrast agent begins, and intravenous diphenhydramine 50 mg 1 hour before the contrast agent is administered. The above recommended prophylactic regimen is for your reference. Let's introduce the second part, reasonable use of Iohexol injection and storage. Iohexol injection is X-ray contrast medium for use in cardioangiography, arteriography, uography, phlebography, and CT enhancement, lumbar, thoracic, cervical mammography, and computer tomography of the basal cisterns following subarachnoid injection. Asography, ERCP, herniography, hysterography, hysterosalpingography. Cellography, PTC, studies of the gastrointestinal tract, and T-tube cholangiography. Etc. The doses of Iohexol injection can refer to the recommended dosage in the package insert for the drug. Iohexol injection needs store sealed below 30 centigrade and must protected from light. A video of a hospital in China can be referred to more specific operations. Let's show it together.
Scan. The contrast media is placed in an incubator in the examination room, and the contrast media is heated to 37 degrees Celsius, which can reduce the viscosity of the contrast media, reduce the stimulation of blood vessels, and improve the body's tolerance to the contrast media. High-pressure syringe. Ensure that the pipe of the high-pressure syringe is smooth, without bending or knotting. The pipe interface is tightly connected, and the nozzle of the front end of the high-pressure pipe can be a pipe for one person to prevent cross-infection. Drug inspection. The bottle cap is not loose, the bottle body is not cracked. The drug is clarified without impurities, no discoloration. Within the validity period can be used. After the patient enters the examination room, check the patient's information again and begin to prepare for the examination.
Okay, this video is for reference only, and the specific operation is determined according to the hospital and the patient's situation. Let's introduce the third part, after using Iohexol injection. The common adverse reactions of Iohexol injection are anaphylactic reactions, which often occur in the skin, cardiovascular, respiratory, and gastrointestinal systems. Among them, the most common adverse reactions are skin reactions, which are mostly acute attacks. In mild cases, acute anaphylaxis may be characterized by limited urticaria and pruritus, but in severe cases, acute anaphylaxis may be characterized by diffuse facial and laryngeal edema, bronchospasm, dyspnea, anaphylactic shock, and even respiratory cardiac arrest, which can lead to permanent illness and even death if not properly managed. When do the adverse reactions usually occur? It was mentioned in a literature reported in China. The peak of adverse reaction occurs within 30 minutes after the injection of the drug. 90% of serious and fatal reactions occur within 20 minutes after injection. 60% of serious life-threatening adverse events begin with any mild symptoms. The mild symptoms generally occur within 5 minutes. There may be also some delayed allergic reactions. Most of them are common skin reactions and generally occur within 3 hours to 2 days after injection. Fortunately, the incidence of acute adverse reactions is very low, and most of the acute adverse reactions are not life-threatening. Severe acute adverse reaction to intravenous injected hypertonic contrast agents are rare, with historical data showing about 4 cases per 10,000 patients. In addition, the reported incidence of delayed anaphylactic adverse reactions ranged from 0.5% to 14%. Although the incidence of acute adverse reactions is very low, once an adverse reaction occurs, it is necessary to stop the injection of the drug immediately and quickly assess the patient's condition and the severity of the adverse reaction, so that different treatment and treatment measures can be taken. Anaphylactic adverse reactions were classified as mild, moderate, and severe. The mild anaphylactic adverse reactions symptoms showed localized urticaria, itching, localized skin edema, localized itch or scratchy throat, nasal congestion, sneezing, conjunctival, runny nose. The mild anaphylactic adverse reaction treatment is usually not required, but it can progress to severe conditions. So closely observation is required for 20 or 30 minutes until stabilization or recovery. The moderate anaphylactic adverse reaction symptoms show diffuse urticaria, pruritus, diffuse erythema, but vital signs stable. showed facial edema but no dyspnea, showed tightness or hollowness in the throat but no difficulty breathing, showed wheezing, bronch spasm with no hypoxia or with mild hypoxia. The moderate anaphylaxis adverse reaction usually not immediately life-threatening, but it can progress to a life-threatening reaction. Therefore, patients need to be actively symptomatic drug treatment, closely monitoring until complete resolution. The establishment of fixed venous access, high flow mass oxygen inhalation, the severe anaphylaxis adverse reaction systems show diffuse edema or facial edema with dyspnea, diffuse erythema with hypertension, laryngeal edema with wheezing or hypoxia, wheezing or bronchospasm with significant hypoxia, anaphylactic shock. The severe anaphylactic adverse reaction can be life-threatening, must be quickly identified and treated, usually required epinephrine treatment. Different treatment measures for different manifestation. If the patient shows no response or no pulse, need to perform CPR. In a Chinese literature, specific treatment regimens for acute anaphylaxis adverse reactions in adults are suggested. This is treatment plan for urticaria. This, this is treatment plan for diffuse erythema. This is treatment plan for bronchospasm. This is treatment plan for laryngeal edema. This is treatment plan for hypertension. Systolic blood pressure less than 19 mm of mercury. The specific treatment plan is not introduced in detail here. You can read it offline. These treatments are for reference only and are determined according to the patient's specific condition. The above is all about Iohexol injection. Thank you for your time.